Okay, Sal, we're ready to start. You're muted, Sal.
Good morning, everyone. Thank you for joining us. This pandemic has exposed and exacerbated the vast inequalities that have always existed in our state and in our country. One thing is clear, this may be the greatest crisis of our lifetime, and working people are suffering. Let's put this in context. The national unemployment rate has skyrocketed to 14.7%. The real unemployment rate, which includes workers not looking for jobs and the underemployed, has surged to 23%. What's more stark is who is losing these jobs. Nearly 40% of working people who earn less than $40,000 a year lost their jobs in March because of the pandemic. To repeat, 4 out of every 10 low-income working Americans lost their jobs in a single month. Now, at the same time, the combined wealth of America's billionaires increased by $282 billion, a nearly 10% increase. We're here today because while we are working to ameliorate the effects of the crisis brought on by the COVID-19 pandemic, we're facing another crisis in the not too distant future. The massive budget deficits facing Connecticut, and really every state in our nation, needs to begin to be addressed. If not, our debt and our deficits will only grow. So while Connecticut faces these budget deficits over the next few years, elected officials will have a stark choice. They can either cut services, housing, and healthcare for low and middle income families who are suffering record unemployment and need these services more now than ever, or they can raise taxes on the extremely wealthy who are hoarding more money than ever before. The choice is clear. Working people in Connecticut are suffering enough. It's time for the wealthy to step up and finally pay their share. To help us understand this from a national context, I'd first like to introduce Josh Blvens, an economics expert and director of research at the Economic Policy Institute. Josh?
Thank you, Sal, and thanks to everybody on the call. I'll just try to be pretty brief and give sort of the national context for this. My name again is Josh Blvens. I'm a macroeconomist and the research director at the Economic Policy Institute in Washington, D.C. We are a think tank that tries to prioritize the economic needs of low and moderate income families in policy debates. So a couple of things about our current economic situation and how that should affect the thinking of policymakers at the state and local level. First thing to know, this is the largest and most sudden economic shock in the history of the United States, decisively more jarring and larger and quicker than what happened during the Great Depression of the 1930s. Besides its size and suddenness, this shock is also different for a couple of reasons. One, it is hit first in low-wage sectors and in the healthcare sector. This is very unusual. Recessions tend to start in construction and manufacturing and propagate outwards. This is different. It's hit low-wage sectors first in healthcare. And also, the shock has been associated with a shutdown of schools, which has led to a host of challenges for working parents and for education of children generally. And so I think the challenge all of this creates for policymakers is that the policy response, it has to be big, it has to be fast, it has to hold low-wage workers harmless so they don't enter the recovery phase of this, hobbled by debt and missed payments during the period of the shutdown when they didn't have an income. And it needs to include big investments in education and health. All this means that state and local governments have an incredibly central role to play in navigating us out of this crisis. Our state and local governments shoulder a disproportionate burden for lots of the programs we're counting on now to help low-wage workers, like the unemployment insurance systems. State and local governments do almost all education investment in this country, and they're on the front lines of healthcare. They run Medicaid, they pay for almost 40% of its costs in normal times, and these state and local governments have lost about a quarter of their public health workforce since 2008. And so we need to build them up, given their importance to navigating the crisis in front of us. There are really good estimates that say the revenue shortfall facing state and local governments could reach $1 trillion by the end of 2021, taken in total. That is totally plausible. There is high quality research that says Every 1 percentage point increase in the unemployment rate reduces state and local revenues by about 3.5% to 5%. We're going to see unemployment peak at above 25% this summer, and there are estimates that it's going to remain closer to 10% at the end of 2021, not the end of this year, the end of 2021. This incredibly high and prolonged sort of forecast of unemployment would be devastating to state and local budgets. And we know what happens if we don't have the federal government step up and help fill in these revenue shortfalls. This means the state and local sector becomes a big drag on growth for years because they face just savage downward pressure on their spending. We saw this recently in the recovery from the Great Recession. The austerity in state and local spending by itself in that recovery delayed full recovery by about 4 years. Basically, if you had taken the trajectory of state and local spending that had occurred in the average recession recovery and applied it to 2009 and after, we would have reached pre-Great Recession levels of unemployment by 2013. Instead, we didn't reach those levels until 2017. And so we should just not do a repeat of what we did during the last recovery, which was to say to state and local governments, you're on your own, and let them just become a big drag on growth. Finally, and I'll wrap up here, I mean, while federal aid is the absolute game changer, it is a necessity, it is the thing that will keep this from becoming a depression or not. That said, states aren't completely without agency here. Tax increases on higher income households and on corporations drag on demand growth far less than budget cuts do. And so to the degree that states are not given the full aid they need by the federal government and they're forced to adopt coping mechanisms on their own, they should choose to increase taxes, especially increase taxes in a progressive way, and try to preserve spending as much as possible as they go forward. So for here, I'm going to stop and I will pass it back to Sal.
Thank you for that overview. Our next speaker is Emily Byrne. She's the Executive Director of Connecticut Voices for Children. Emily?
Thanks, Sal. So what we're all seeing firsthand that the economy doesn't exist separately from people, right? That the health of the public is the health of the economy, and endangering one endangers the other. What we're experiencing is certainly unprecedented, but our economy would have been much more resilient against the shock of COVID-19, both on a health front and an economic front, if we had done more pre-pandemic to include people who have historically been left out and left behind. We know from research that the suffering we're seeing today, disproportionately by people of color, is the result of centuries of bad policies, and only the development and passage and implementation of equitable policies can stop it. To this end, we at Connecticut Voices for Children believe that every policy and funding decision should lead us to the future we want, which is a fair and just society where all Connecticut children and families can thrive. And so what we're calling for in the state is first, robust financial investment to stimulate the economy. Second, a progressive tax system that works for everyone so that we can recover equitably. And last, but certainly not least, oversight and accountability to promote transparency and democracy, as well as ensure funds are going where they should. The data is clear and pretty widely known. Tax revenue in the state is significantly down. And even with news of the economy slowly reopening this week, initial UI benefits numbers continue to rise. Still, cutting the state budget is not the way forward. Budget cuts not only erode the infrastructure that make communities vibrant places to live and work, they also have long-term negative consequences on the economy, like Josh said. For reference, right, again, it took 7 years for the country to reach pre-recession GDP numbers, and it took Connecticut even longer than that. And that's because a number of economists believe that the fiscal response to the Great Recession of 2008, while significant, was wholly inadequate. I think this is due in large part because the US has relatively weak what's called automatic stabilizers. These are programs like UI benefits, Medicaid, SNAP, et cetera, which means that we need to enact more discretionary fiscal relief and stimulus in a downturn. As a country and state, we should aim to deliver a knockout punch to this current recession in order to prevent and economic depression. And so at the very least, we need to maintain our state and local spending levels. Doing so could require a combination of an infusion of federal dollars, drawing down on the state's budget reserve fund, as well as raising state revenue to fill the projected shortfall. However, with regards to the latter, we know from research that a regressive tax system like the one Connecticut has exacerbates economic inequality, which further hurts the economy. Therefore, what we want to do is raise revenue through a progressive tax system. For reference, when you consider the various Connecticut taxes, property, sales and excise, business, personal income, estate and gift, the regressive nature of the combination makes it so that a working class family with a pre-tax income of $40,000 has an effective tax rate of 23.6%, therefore taking home roughly $30,000. A middle class family with a pre-tax income of $100,000 has an effective tax rate of 13.3%, taking home roughly $86,000. Whereas a wealthy family with a pre-tax income of $1.5 million has an effective tax rate of 7.4%, taking home $1.39 million. The last thing I'll say is to reiterate that the COVID-19 crisis has exacerbated the structural inequality that existed before the pandemic. The hard truth is that the rise in unemployment and long-term economic damage resulting from the crisis is a policy choice. The good news is that we can choose a different path. And while this certainly won't be easy to do, if there were ever a moment to reimagine the possible, now's the time. And if we lead with our shared values, I know we can get this right. Sal?
Thank you very much, Emily. Our next speaker is Representative Ann Hughes, co-chair of the House Progressive Democratic Caucus. Ann?
Thank you. And thank you for inviting me. Emily, your remarks really set this up so well because we have been really complicit in policy violence in our tax structure and in our economic structure. And we're asking the frontline workers to risk their lives, and yet and now we're looking at possibly cutting some of those essential services on a statewide level or a municipal level to balance a budget, and this is starving our our economic recovery, if there is going to be one. Every other first world country has tax-paid healthcare, has affordable medications, has interest-free college, has a living wage. We have 26-year-olds dying for lack of insulin. This was before the pandemic. We have predatory student loans that people are in debt for life. We have medical bankruptcy. And this is a systemic failure of investment on state and federal levels. And now we have frontline healthcare workers that are being impacted the most by this pandemic, being exposed and getting ill and losing their lives and their families' lives because of this policy violence that we have inherited. So we have been looking at prioritizing a value worker driven economic recovery, and we have a letter that is going out, and we're trying to get a public momentum going, not just among the legislators, but among DTCs and other organizations, that we're respectfully asking the governor's plan and Connecticut's plan to address the fiscal and economic crisis facing Connecticut to include measures to reshape the upside down tax structure that's held our state back. We don't want to see a cut to public services in order to balance the budget. We can see how this further creates policy harm and policy violence, nor should our budget be balanced primarily on the backs of the middle and working class Connecticut families. Currently, the wealthy pay less of their income in state and local taxes than everyone else. In order for us to emerge from this crisis stronger than before, that must change. Each passing day, hope decreases that the federal government will provide the support we need. U.S. Senate Majority Leader Mitch McConnell has already indicated he's willing to let states go bankrupt. And even if we were to receive federal funding to address our fiscal challenges, it will not be enough to fully replace our estimated revenue loss. we must be the ones to act. It is our responsibility to ensure that the economic pain caused by this crisis does not fall only on our state workforce or on our working and middle class Connecticut residents. Our state's most vulnerable has already done their part by risking their lives on the front lines, but we're all in this together. It's our time to ask the financially most fortunate in our state to pay their fair share. There are, you know, the real estate in Lower Fairfield County, in Greenwich, and in North Stamford, and in my district the phones are ringing off the hook. There's a lot of people from Manhattan that want to move out to the country, that have a lot of means, and what they want to move here for is to be, you know, safe from infection, but also for our excellent healthcare system. So we need those folks that are financially most fortunate to be first investors in our infrastructure, first investors in Connecticut as a model that prioritizes people's health, a value-driven economy, and investment of our structures, our human services over profit first. And that's going to drive our economic recovery and our like we mentioned, it's all interconnected to our health recovery. So I'm pushing my co-legislators, our progressive caucus to champion this, but we are reaching out to the public because the public also has to drive this administration and recognizing this new reality. I don't think the wealthiest are going to flee because we're asking them to be first investors, because where they're going to flee to? Florida, where they're going to get infected, and all the wealth in the world doesn't protect you from this virus.
Thank you very much, Representative Hughes, and all of the speakers for pointing out that the rich get richer and the poor get poorer, and it's because of the choices that we make in terms of our policy. Our next speaker is Rochelle Palache. She's the Assistant District Leader of 32BJ SEIU in Connecticut. Rochelle?
Yes, good morning. Thank you, Sal. Good morning, everyone. I'm proud to speak on behalf of the 5,000 men and women in the Connecticut district of 32BJ SEIU. They are janitors, security officers, and other building workers employed by the private sector, sometimes at state buildings, but more often in the commercial sector in every major city in Connecticut. Like so many essential workers in this pandemic, these men and women are mostly immigrant and people of color. Though whether Black, brown, or white, foreign or native born, they are all confronting this crisis in profoundly noble yet difficult ways. About 20% of our union members have been laid off. Those receiving unemployment have certainly benefited from the additional federal assistance, but some have already begun to lose their health insurance, and all are worried about the complex and unsure prospect of returning to work in a recession and in an unresolved pandemic. The 80% who still are showing up to work do so facing shortages of PPE and the prospect of contracting a potentially lethal virus, all for a modest wage that has not been raised for most of these workers. Yet they show up, they sanitize, disinfectant, protect vital services and industry, and they pay their taxes, a burden that proportionately falls more heavily on low-wage workers than others. And of course, some have paid the highest price. In our union as a whole, we have lost 110 members, including now 6 here in Connecticut. A member just passed away over the weekend. In short, low-wage workers are already paying the highest price in the pandemic. The dreadful inequalities of this pandemic must be addressed in our budget priorities. That's why we joined this press conference today and the caravan traveling to Greenwich on Thursday. The wealthiest among us must share their portion of the burden of this historic crisis and not profiteer from it. The same also goes for wealthy corporations that have long abused their lowest paid employees. That is why on Thursday, the caravan will stop at Darien I-95 Service Plaza, where McDonald's is still not offering their employees any paid sick days whatsoever, and still may not be practicing proper disinfection routines. It is also why in the next few weeks, security officers are visiting the shareholder meetings of some of these large corporations in the Hartford County. Corporations that use private security firms but do not offer their workers affordable health insurance. Insurers not protecting those who protect them. Fast food corporations refusing to support workers who risk their lives. The rich getting richer while the poor is dying. These injustices are worse than ever thanks to the coronavirus pandemic. And we cannot afford to continue to ignore the inequality on which it feeds. In the upcoming budget, revenue streams must be made in a more equitable way. And wealthy individuals and corporations need to do their fair share. They need to pay their fair share to make sure that we all can get the quality of life that we all deserve. It's time for them to step up. Thank you.
Thank you, Rochelle, and thank you for being an articulate voice for the members that you represent. Our next speaker is Stacie Harris Byrdsong. She's the president of AFSCME Local 3194. Stacie?
Good morning, Sal. Good morning, everyone. I'm Stacie Harris Byrdsong. I serve as Executive Secretary of Council for AFSCME, a union representing 30,000 workers in Connecticut. I'm also the president, as Sal has said, of AFSCME Local 3194, representing paraeducators, lead educators, oral interpreters, and childcare workers at the Capital Region Education Council schools. And throughout the COVID-19 pandemic, we constantly hear people say, we are in this together. While that is an accurate assessment, the economic impact from the pandemic has not fallen on everyone equally. The COVID-19 crisis has caused tremendous economic damage to working families and children across Connecticut. I'm here to join the call asking for the wealthiest of the state to pay their fair share of taxes to help dig us out of the hole created by this COVID-19. We live in one of the wealthiest states in the country, yet we are home to some of the most impoverished zip codes in the country. Connecticut is a true representation of what income inequality looks like. Since the Great Recession, wages have remained stagnant for the working class, yet expenses continue to rise and budgets are balanced on the backs of working families struggling to make ends meet. Working families in Connecticut, we have sacrificed enough. Now is the time for our wealthiest residents to step up and take up a greater share of the tax burden. We are in this together, but more so if the economic sacrifices are shared amongst the affluent. Remember, we are in this together. Thank you, Sal.
Thank you, Stacie. Well said. Our next speaker is Rob Burrell, president of SEIU District 1199. Rob?
Good morning, and thanks to all the previous speakers for taking the costs of the economic recession down to the human level. My union represents 25,000 healthcare workers across the state of Connecticut, primarily in long-term care and amongst state employees. Caregiving is very much an act of love that our members give on a daily basis to the sick, to provide compassionate relief to folks who are in distress. And so our members know absolutely what it means to come together in a time of crisis, to unite, and to make sure that those who are sick and elderly and disabled have the dignity that they deserve, regardless of the color of their skin or where they come from. They also understand in the context of this pandemic what it means to sacrifice themselves, their own health, and in many cases their lives. And in addition to that, the health of their own families, and again, in some cases, the lives of their own family members. Our members, when this crisis began in March, had almost no access to PPE. 8 weeks later, we still do not have enough personal protective equipment, particularly in nursing homes across the state, where workers have had to reuse the same masks, gloves, and gowns in some cases for 3 weeks at a time. The quality of their personal protective equipment is degrading. There have been 11 members of our union who have lost their lives in this pandemic, and an equal number of family members who have lost their lives. We should ask ourselves as a society, who is being asked to sacrifice? We are calls that I consider to be quite cynical in many cases about shared sacrifice, but who truly is sacrificing? Our membership is primarily Black, brown, and low-income white. And so these are the folks who are the glue right now: nurses' aides, nurses, social workers, clinicians, the glue that is holding our society together, and exactly the same populations in terms of our public health infrastructure and our public health workforce that is going to be asked to make cuts if we do not plug the hole that is looming, the gulf that is looming in our state's budget. What we should be doing right now is to be expanding the infrastructure for public health, asking the wealthiest among us to contribute their fair share. We've seen in recent years the Trump tax cuts. We've seen the Trump stimulus, which has shoveled mountains of money at the wealthiest among us and corporations. Connecticut nationally has the 5th most billionaires of any state in the country, 17 individuals who collectively control $66 billion in wealth. And so the time is right for them to share in the sacrifice for the first time. We're going to take them at their word when they ask us to share in the sacrifice. Our members have sacrificed already. They've done so willingly. They've put themselves in harm's way, and they've done it in a way that is something that they were quite willing to do. What we're asking for is for Connecticut's billionaires and multimillionaires to make a much easier sacrifice, to give a little bit of their wealth to the working class of this society, white, Black, and brown, so that we don't have to give even more than we've already given. Thank you.
Thank you very much, Robin. And we know how many of your members have been ill and how many have died. And our hearts go out to them and their families. Our next speaker is Reverend Josh Pawelek. He's the third minister of the Unitarian Society. Reverend Pawelek.
Thank you, Sal. I'm Reverend Josh Pawelek. I'm the minister at the Unitarian Universalist Society, East Manchester. I'm also leader with Moral Monday, Connecticut, a leader with the statewide Domestic Worker Justice Campaign, and a leader with the Greater Hartford Interfaith Action Alliance. Thanks for the invitation to address this press conference. I think the proposal is clear: to sustain Connecticut's capacity to provide sufficient safety net supports, to meet basic human needs for poor residents, low-income workers, and all the newly unemployed workers. We need our high-income residents to contribute a greater share of their wealth to sustain a state budget that works for everyone. For decades, we have been naming the increasing level of income inequality in our state and nation. We have cited study after study that says this inequality is not only unsustainable from an economic standpoint, but it is also slowly eroding the health of our communities, slowly eroding our social cohesion, slowly undermining principles upon which our state and nation were founded. As such, growing level of income inequality is morally unsustainable as well. Supporting policies that increase income inequality, whether intentional or unintentional, is a strategy for state and national economic ruin and moral decay. Asking for a tax increase on the highest is not class warfare, although I assure you that among income workers in our state who could not get ahead prior to the pandemic and who are now crushed by economic conditions during the pandemic, it certainly feels like class warfare. Representative Hughes used the language of policy violence. That is precisely how low-income workers experience conditions now. And asking for a progressive tax structure, not to punish anyone for being wealthy. I appeal to legislators, to all those who have extraordinary financial resources available to them. Look around, look closely, level of suffering, the food insecurity, the housing insecurity, healthcare insecurity. Understand that we were witnessing a moral failure to care for our own prior to the pandemic. Understand now that we are witnessing moral catastrophe in the midst of the pandemic. Look, understand, and find within that spirit of generosity, that spirit of unity, that patriotic spirit, that first investor spirit, that love of Connecticut spirit, that love thy neighbor spirit. Now is the time to respond to that spirit, not the spirit of greed, not the spirit of dismissal, not the spirit of denial, not the spirit of hoarding, the spirit of generosity. We can weather the economic fallout from this pandemic. We can address the economic fallout from years of tax and fiscal policy that have allowed economic inequality to increase and welfare and cohesion to decline. Let's put Connecticut's people first. Let's finally make the hard decisions that will reduce income inequality and strengthen the fabric of our state.
Thank you very much. That's clearly a clarion call to action. So we thank you. I guess we'll open it up for questions. Dave, if you want to moderate for any reporters that want to ask a question.
Sure. Thanks, Sal. We have 3 reporters lined up, just to let people know. We have Christine Stewart, Ken Dixon, and Keith Faniff. We will start with Christine. If you want to unmute yourself, you can ask a question.
Okay. Thank you guys for hosting this today. I wanted to know what your proposal is to increase. Is it to increase the income tax? And if so, by how much are you proposing to increase the income tax to make up for the billions in lost revenue?
In our letter, it doesn't have a specific proposal. That's got to go through the finance chairs. And since we're not in session, we're just asking that we be part of the any kind of emergency budget related session, that this be lined up ahead of time. So we don't, we know that the budget shortfall, I think I wrote that, is projected to be $4.5 billion gap with an estimated $7 billion over the next 4 years. So we're looking for this revenue source to be specifically addressing that shortfall before we, and it might be a combination of, you know, wealth and top personal income tax, but before we cut any more essential services or workforce.
Okay, and so what are you then doing to get the legislature back into session?
It's a good, you know, talking to leadership all the time. We're ready to tackle this now. We're quite frankly not really being invited to be back in session yet.
Thank you.
All right, thank you, Christine. Next, we will go to Keith Faniff. If you want to unmute yourself, you can ask your question.
Thanks. Can you hear me?
Yes, we can.
Okay. If possible, I'm going to try to ask 2 quick questions. Let me go right back to Representative Hughes first. Ann, can you tell me, because we can do the counting, we know the Republicans are not going to lend any votes at all for any type of revenue increase on the income tax. How do you deal with the significant portion of your own party, including Governor Lamont, who at least so far have been steadfastly opposed to any type of increased progressivity in the state income tax? Strategically, how do you cut that Gordian knot?
Yeah, I think that's a great question. Well, I think a pandemic changes everything because the virus knows no bounds. So wealth does not protect people from being sick or accessing our excellent hospital systems. And you know, that's why people are coming here. That's why wealthy are flocking to Lower Fairfield County. So they're not saying, well, I don't know, how are you guys going to deal with your shortfall? We have good fiscal and bonding rating because we've protected our rainy day fund. Now is the rainy day. Now is the catastrophe that we saved for. And now we have to not further catastrophize it based on the people that are bearing the most impact of this pandemic. So that changes things. That changes from just 6 months ago when we're like, no, we don't want to touch the wealthy's tax rate, they'll leave. Where are they gonna go? Where are they gonna go? I mean, these are my constituents too. And I'm just asking that everyone be the heroes, not just the frontline workers risking their lives, but everybody do their part. Everybody do their part to get Connecticut out of this crisis. We're 3.5 million people. We can do what the federal government cannot do for Connecticut right here within our means, if everybody is willing to do their fair share. So that's why we have to get this out in the public to push, including the wealthy, to say, I'm ready to step up and invest in Connecticut.
And just thank you. Just one other quick question. Could I ask Josh and Emily how much they think the regressive nature of Connecticut's state and local tax system, with our heavy reliance, not just on property taxes, but the sales tax, quite frankly, left us unprepared for the pandemic in terms of small businesses and households that were already on the bubble long before anybody started getting sick.
So I'm going to defer to Emily on specifics about the Connecticut tax system. She definitely knows more than I do. I mean, I would say when I wrote a report on Connecticut a couple years ago about their revenue system, and I was surprised at its lack of progressivity for such a rich state on average. They still have a lot of room to raise taxes in a progressive way without getting to the edge of sort of what other states in their region do in terms of what they ask from higher income households and businesses. And so, yeah, I think the country as a whole was really unprepared for this shock because we have so many families that live paycheck to paycheck and just sort of lack the buffer savings they need to get through something like this. And I think one reason why we lack systems that provide that protection is precisely because we don't ask enough of people who have made so much of the money in recent decades. And finally, I would say, it's too bad that that's how we're entering this crisis, but it does mean, facing the shortfall in front of us, there is now room to go tap those higher income households and corporations for more money. And that would do far less to restrain growth than budget cuts would. Budget cuts will be an absolute disaster for growth going forward once the public health crisis is passed, whereas asking more revenue from higher income households and corporations would not be a disaster. So it seems to me that the choice is clear.
Yeah, I would agree with Josh that the choice is pretty clear. It's hard to answer that question specifically, Keith, because we don't know what the numbers are right now. We'll have a better sense when the state kind of produces those numbers in the next 2 to 3 months, I suppose. And I say that only because they're changing every day. So I think for us, spending, raising taxes can reduce consumer spending and slow economic growth, but I think the Great Depression and the Great Recession have shown that this is less damaging than the alternative, and Connecticut is really well situated right now where you can create a wholly progressive tax system by looking at all of the taxes, and that can create at least some sort of equity moving forward beyond a federal or state stimulus that's needed right now.
Thank you.
Thank you, Keith. Any other reporters have questions for the speakers? We'll give everyone Paul Hughes with the Republican American. Unmute yourself and ask your question.
Yeah. What about labor concessions? I think Ron referenced them in his comments. the governor has indicated that he's going to be reaching out to state employee unions, as you guys have been talking about, to help out. Everybody's in this. So what do you think of that idea from your perspective?
This is Sal Luciano. So I think they gave concessions in 09, in 11, and in 17. I think you can make the argument that the reason they have the rainy day fund at all is because it was paid for by state employees' 3 concessions. To go back to them a 4th time when there are already worries that in 2021, 22, it'll be difficult to recruit people because the benefit packages have been eroded. And again, you're going back to people, people who are already paying 24% in taxes and who have had 6 years of 0 raises in the last 10, and to ask them to continue to take wage cuts at this point when many of them are also on the front line of the COVID-19 pandemic. Correction officers, child abuse investigators, all of the people, the nurses who are working long hours in the hospitals, who have not had raises in a while, and asking them again to take further concessions. I don't think the union members are ready for a 4th round of concessions at this point. And every time we say shared sacrifice, it seems we're talking about making state employees pay more, and working people, which they also are included in that, pay more in taxes. While we never see anything from rich people. In fact, the last shared sacrifice, the wealthy actually got a state tax relief. So while everybody else except the rich were sharing the sacrifice. And this is why in this critical and unprecedented time, we're asking those who are actually making more money while other people are losing their jobs to finally step up.
I'll just note that amongst 1199 state employees, people for the past 9 weeks have been showing up in the state's prisons, in state group homes, in state psychiatric hospitals, in the state's public hospital in Farmington, day in and day out, caring for the sick in COVID positive environments, risking their own health, risking the health of their family members. 3 of our state employees have lost their lives due to COVID-19 that they contracted while on the job. They have sacrificed. They understand what it is every day to go to work in an environment where you're risking your life. And all we are asking is that the state of Connecticut show some balance in terms of when sacrifices are asked. We're not asking the rich to sacrifice their lives like our members are. We're not asking them to risk their health. What we're asking for is that they help to share the burden of the recovery, which is made possible by those same state employees who have given up tremendous concessions in the past decade and who, again, have gone to work willingly in a dangerous environment for the past 9 weeks and are going to continue to do so. So we're asking that the folks who are the most fortunate in our state share some of the burden with the folks in the working class who've been doing so.
Okay, thank you.
Any other reporters have a question for any of our speakers? Let's give them a moment. Don't appear to be any more questions, Sal. If you would like to close.
I want to just thank everybody and all the reporters and all the speakers. Clearly, there's a clearing call that we absolutely need to do something. And if we're going to share sacrifices this time, we really need to make sure that those who have never had to step up in 08 and in other difficult financial times, that they step up now. You've heard the facts and figures, and you heard that there's a stark choice to be made. We either continue to make the poor poorer and the rich richer, or we take steps to try to help everybody in this time. And we can see the insecurity, even for how to put food on the table for one day when we look at Rentschler Field and some of the other places where the need has been so dire. So again, we thank everybody, and we hope that we've educated some of the public to put pressure on their legislators so that they can all start being more like Ann Hughes. Thank you.
Thank you, everybody.